Hi everyone and welcome to the special Q&A with ACT. I'm Angelina, ACT CEO, and I'm here with Dr. Elizabeth Hughes.
Hi, I'm Dr. Elizabeth Hughes. As Angelina said, I am a dermatologist and I'm also the Chief Medical Officer here at ACT Bio.
Thank you all so much for sending in your questions. We have gotten so many on the topics ranging from diet and psoriasis, the sun and psoriasis, different treatments, phototherapy, scalp psoriasis and the remedies for that, the influence of the environment and other lifestyle factors. So we will cover everything and you will see the timestamps under the video so you can hop around and look at the topics that interest you. And stick around till the end because at the end of this video, we will announce our new launch, our new product that we have been developing with Elizabeth for so long. And this will be a real game changer for psoriasis. We are so happy to be launching it and we will be introducing a discount for this product. So for sure, stick around. By the way, we have done one of these Q&As previously with Elizabeth, and we have covered something like 30 questions, and that is live on our YouTube channel. So you can go ahead and watch that on our YouTube channel that is called ACT Bio. So if you guys want any other tips, of course, you're very welcome to download our app, the ACT app that is now in the beta version, but will be soon available. And of course, visit the ACT Bio website to see so many more tips on psoriasis from Dr. Hughes, who is very active with publishing her new tips.
A few of you submitted some questions that were really specific about your medical condition. And unfortunately, I can't answer those in this forum. So if we don't get to your question, it's not that, I haven't read it, I missed it or anything like that. Just wanted to let you know that I can only really talk about general things. And when it comes to things that are really specific for you or a family member, it will require a totally different format to answer those questions. So I just want to let you know that we both have seen all the questions and want to give as much information that's useful to as many people as possible.
Okay, so the first topic that we wanted to cover is treatments, but we will be, generic and not providing any specific advice. But Roberto is asking, I never cured my psoriasis with drugs because I fear the rebound and to worsen my psoriasis long term. Am I right?
Yeah, it was a great question, Roberto. Thank you for sending that one in. So I want to talk about the concept of a rebound first, so that we're all talking about the same thing. As a dermatologist, I know that psoriasis is a chronic condition, and that when it is not treated for a period of time, it usually comes back, but it'll come back slowly. That would be a normal behavior of psoriasis as I see it. And that doesn't really count as a rebound. A rebound is when you stop a medication and the psoriasis comes back quickly and often worse than it was before. So in terms of, are you going to have rebound with every medication? No. And that's not something that's going to happen. It doesn't, psoriasis doesn't automatically rebound when you stop using medications. In fact, I have seen very few people have a true rebound effect. So I think there's more concern about that out there than is actually than you actually see in the world. So now, on the flip side, your question does point to something really, really true, is that there are no completely curative treatments for psoriasis at the moment. So if you choose to treat your psoriasis only with medication, it means that you're going to need to use medication of some sort for the long term. But is it going to rebound? That's actually a pretty rare phenomenon. So if you want to try medication, I wouldn't let the concern about rebound stop you. I also believe that even if you're on medication, doing the lifestyle modification that we talk about at ACT actually helps to control the psoriasis and augments the medicine, makes the medicine work better. And once you've established those lifestyle modifications, if you choose to stop medication, your risk of a rebound or a flare afterwards is much lower. So, good question.
Great. And our next question regarding treatment is from Bash. It's a longer one. Bash is saying, there is a life cycle to my flare-ups. With time, I realized that different products can be used at different phases of my flare-ups. For example, when red and inflamed, use steroids. When scales start building up and skin thickens, use cream or wash with salicylic acid. Once inflammation calms, use Vaseline to keep moist. Using just steroid and moisturizer, what dermatologists prescribe them, for the whole duration seems to be damaging the skin more than helping with scaling and dryness. What other products for these uses would you recommend, and what would be the ideal schedule/timeline of product use for flare-up that sticks around for 1 to 2 months?
All right, great question. Some of these are a little specific, so I'm going to answer in general terms. So it sounds like the only prescription medicine that you've received is steroids. And that's a small bit of the available medications, topical medications, medications that go on the surface on your skin, that there's available. There are a lot of prescription medications that do not contain steroids that are designed to be used for longer term and don't have that sense that it's doing more harm than good, which I understand. I actually understand that. I'm a dermatologist that doesn't really like steroids for the long term. So you might want to talk with your doctor about things that can be used intermittent, well, let's say between the flares, that can spread your flares out, that don't rely on steroids. There are creams based on vitamin D and vitamin A. One called, the vitamin D is calcipotriene. There's a vitamin A derivative, a tretinoin derivative, that will work over the longer term. And there are some newer ones as well that go by the name of like Vitama here in the United States, that aren't steroids, that are designed for long-term use, that don't damage the skin. The other thing I would say in general, you don't need to wait until you start to see scale build up to use something that contains salicylic acid or lactic acid that helps to keep the skin thinner. We'll talk a little bit about exfoliation later, but salicylic acid and lactic acid are things that actually cause a gentle chemical exfoliation. And that's actually okay for your skin to use in between. You might not want to use it every day, but you might want to use it a few times a week to help to keep the scale from even starting to build up. Because once you see scaling starting to build up, you're already kind of a little behind and you have to do a lot of catch up with it. So in short, go see your doctor about some other medications. There are lots of them that can be used long-term that don't have steroids. And maybe use your salicylic acid more regularly when your skin is okay.
Excellent advice, Elizabeth. The next one is from Marcella on methotrexate. Marcella is saying, I just started with methotrexate and I'm really scared. But is the benefit real?
Yes. Yeah. In short, yes. And I will methotrexate. Yes, it's a scary medicine. When you think about all of the side effects, but I've seen very few people have problems with methotrexate, and lots of people get lots of benefit from methotrexate. So the benefit's real. Absolutely.
Awesome. And our last question in this category is from Roberta. And Roberta is asking to just talk about scalp psoriasis treatments.
Yes. So Roberta, yes, you described what a mess it is to put on gels and ointments on the scalp. And oh boy, I get it. Treating scalp psoriasis is one of the hardest things. It would be really easy if we had no hair, right? Just shave your hair up and it'd be fine, but that's not life. Like, that's not going to work for the real world. A few things that I can recommend. It sounds from what you listed that you had used that you had never tried something that actually is in an oil formulation. There are a few things out there that are in oil that do penetrate into the scalp better. And you might be worried, oh, that's going to make my hair really oily all the time. Well, these oil-based things are designed to be used a few times a week. So you might use them 2 or 3 days a week, like Monday, Wednesday, Friday, or Tuesday, Thursday, or something like that. And that can be a really good option for you. The nice thing about the oil-based is you can use them over the whole scalp. When you've got an ointment and you're trying to get it like into one part of your hair, it's really hard to like know if you're hitting the right areas, but using the oil treatments can go over your entire scalp much more easily. The other little trick is you can take some conditioner, put your medication in conditioner, like, and shake it up, take it, get a little bottle, put some medication and put some conditioner, kind of equal amounts or maybe a little bit more of the conditioner. Shake it up really well, and that can help you spread it in your scalp a little better.
That's an excellent advice, Elizabeth. I think that's really underrated. So kind of in the treatment category, but we have a few questions regarding phototherapy specifically. So Melis is asking, are phototherapy devices, the ones to use at home, harmful?
In general, no. If you get one of the prescription devices, they are just as good as the ones that you get, phototherapy you use in a doctor's office. They may be a little bit different, and you may have to use the phototherapy box, your home box, for a little longer because their output just isn't quite as powerful. But it is a prescribed treatment, and the treatments are measured, and you really can't go overboard with it. So I don't think they're harmful, and I think more people should use them. But if you're talking about a home tanning bed, something you didn't get with a prescription, that's where you can run into harm. So if you get a prescription phototherapy device, not something to worry about at all. And I actually wish more people knew about that as an option for treatment. I think phototherapy is really, really good. And I just want to back off for a moment and talk a little bit about, sun exposure and skin cancer, because, as a dermatologist, I tell pretty much everyone, don't get too much sun. Phototherapy, when used in prescribed doses, under a doctor's orders, actually does not increase your risk of skin cancer, particularly the ultraviolet B. It's just not an issue. And the great thing about phototherapy is that it doesn't matter if you're on another medication, unless you're on a medication that makes you sensitive to the sun. But some people can't take a lot of medicines because of other medical conditions, because they're on medications, because they're pregnant, because they're breastfeeding. Phototherapy solves all those problems.
That really resonates with me as someone who has lived through severe acne. I think phototherapy is a relevant tool for acne as well. And that's the fact that it's topical and doesn't affect your whole body like retinoids or like biologics do for psoriasis is a great option for those groups, as you said, pregnancy and other people that cannot handle systemic medication. Awesome. So AJ is asking about phototherapy. Can light therapy heal psoriasis permanently?
Good question. So, as I said earlier, there's no permanent cure for psoriasis, but phototherapy becomes pretty darn close. For those of you who haven't used phototherapy and aren't familiar with it, the way it works is you get phototherapy pretty intensively, like 3 days a week in a doctor's office for about, let's say, about 10 weeks, 10 to 12 weeks. And over that time, you will see your psoriasis clear. Now, it might need to be a little longer depending on how much psoriasis you had at the baseline and some of those characteristics, but that's the idea. You come in 3 times a week for a period of time until the psoriasis is clear. And then you enter a maintenance phase where you might get phototherapy 1 or 2 days a week. And I have seen people stay clear by just coming in for phototherapy once a week. And that's where the home phototherapy devices are really great. So you don't have to go into a doctor's office. And once so you can just do it at home. You can, just get your phototherapy you have it in your closet. You just plug it in and ta-da, there you are.
Great. Yes, I think with the technology progressing so rapidly, it's just so accessible. Like all those treatments, even medical grade skincare now is accessible at home, and so many devices are becoming so accessible. So now we're moving on to the next category of questions, which is triggers. And here at ACT, we're all about triggers. We help you guys track your triggers in our app. We help you identify which trigger is the most impactful for you personally. And in the future, long term, our goal is to predict your psoriasis flare ups and help you really manage triggers really long term. So, the first question is, I want to know that whenever I was suffering from colds or nose blocks or cough problems, that my psoriasis was aggravating. So, do colds and infections aggravate psoriasis?
Yes, absolutely. And in fact, well, there are a couple different things that I can talk about here. So psoriasis is a disease, a condition that is inflammatory. And what people don't necessarily realize is when there's inflammation from almost anything, your skin will respond. The inflammatory system, the immune system that causes inflammation, once it's triggered as showing inflammation, it shows inflammation everywhere. So if you have cold or allergies or something like that, that's your body is responding with an inflammatory response, the inflammation can make psoriasis worse. Absolutely. Now, and it seems like what are called upper respiratory infections, things like coughs and sinus infections and sore throats and strep throat and things like that. Those things seem to trigger the immune system to make more psoriasis particularly well. It's like a really, really strong connection. So if you've noticed this is a known fact that these respiratory illnesses will make psoriasis worse. So you're not crazy. It's something people know. So for you as a person, if you know that getting a cold or getting a cough, you might choose really to protect yourself if you're going to be around someone who's sick. Now we're kind of used to wearing masks some of the time. And this might be a thing if you have to go over and see your sister and her kids are all sick. Wear a mask while you're around the kids. Protect yourself because you know that you might end up with a psoriasis flare if you do pick up their illness.
Right. That's excellent advice. Very practical. And we are tracking, whether you are sick a particular week in our app, because this does impact your psoriasis flares. And we do take that into account when calculating your scores and when displaying your graphs in the app. The next question is from Bash, and Bash is asking, is there any test for psoriasis patients that can assess triggers for flare-ups? Could be through insurance or be done privately. For example, food sensitivity tests, allergy tests, a test that measures toxin levels in the body.
Oh, Bash, that's a wonderful question. So the answer is no. There is none available now. Although, as Angelina alluded to, that is something that we are working on here at ACT. There are ways to track the level of psoriasis activity in the body before it sort of breaks out into your actual skin that just aren't used very much. So this is something that will be done in the future. But I want to go a little bit more specifically because you asked about like a food sensitivity or allergy tests. The funny thing about psoriasis, and sometimes it's difficult, is that there's usually not one thing that triggers psoriasis. Aside from, let's say, getting a cold, often if a person has a flare of psoriasis, it might be, your diet hasn't been really good for the last week and you didn't get enough sleep and there's a little bit more stress in your life. And those three little factors together might come together to cause a flare. So we'll talk about this in future. a lot of times people want to look for that one thing that causes their psoriasis to flare. And bad news is there's usually not one thing. In fact, 99% of people have multiple different factors. And that's why looking at what's going on in your life in a holistic way, how much sleep are you getting? How much, how stressed out are you? How much exercise are you getting? All of those little factors come together to cause psoriasis flares. And there's not a test for it, but there is a tracking mechanism, and that's what we've created.
This is, I mean, that this is the role of technology, since psoriasis is so complex, this is just overwhelming for a human brain to handle. It's just impossible to keep track of all of these triggers in your head and, remembering your past history. But this is where computers come in. Computers
Right.
can resolve, this system of 20 equations and figure out which is the trigger that is most aggravating for you personally. We can take data from other patients like you and say that, hey, for you, Elizabeth, this trigger is more aggravating than for our average patient. And a computer, and especially with the data that it has access to, can do all sorts of manipulations that a human brain is just unable to do. So the next question regards menopause. The user is saying, I was late menopause at 60. This was when I developed guttate psoriasis that I have now had nearly 18 months. Do you think hormones could have been a factor? I had no strep throat or similar.
Mm. Yeah. So for those of you who aren't familiar with guttate psoriasis, that's a particular pattern of little tiny bits of psoriasis all over the place. The word gutta in Latin means drop. So it looks like droplets of psoriasis, that guttate form. And that's highly, highly related with having a strep throat or having exposure to strep throat. But some people just have that as their pattern of psoriasis all the time. So if you didn't have strep throat or a similar condition, it's still possible to get guttate psoriasis. The question about whether or not hormones are a factor, I don't believe so. That's not something that research has shown. What there is, though, there's a what's called a bimodal age distribution for when psoriasis comes on. Most people, and when they say bimodal, it's like if you track time on the x-axis, linear, and you say, there's a peak here and a peak there. So there's two humps of the onset of psoriasis. Most people first develop psoriasis late teenage years, 20s, maybe early 30s. And so there's that young adulthood peak. But there's another peak where in the late 50s to early 60s, people will develop psoriasis again. So I don't believe that hormones played a role for you. I think that you are rare on two accounts. That would be my guess, that you have guttate psoriasis as your primary form of psoriasis, and that you're one of the people who got it as a late onset condition.
Makes sense. So switching gears completely, we now have two questions that didn't really belong to any category, but we placed them under triggers. So the things that maybe could trigger psoriasis. So one user is asking if it's safe to get breast augmentation if she has mild psoriasis, not located in the chest region. The next question is from Marcella, and she's wondering whether it's possible to get a tattoo.
Yes. What people are pointing to here is the question of what's called the Kebner phenomenon, named after a Dr. Kebner, who recognized many years ago that areas that are injured, either surgically or traumatically, will grow psoriasis often. And so what the first user is concerned about getting a breast augmentation would be in the scars, would you get an increase, would you get psoriasis even if you don't have psoriasis in that area? And the same question for a tattoo, which is of course lots and lots of little traumatic injuries to the skin. I'm going to give you my standard advice. If it's something optional, if it's not life-threatening, if it's not something that you have to do, I would think long and hard before getting a procedure done, because the Kebner phenomenon can happen at any time. to a person. Not everybody gets it, but many people do, and you can never tell if you're going to be that person. And there is nothing at the moment that anybody can do to prevent that from occurring. What's unusual is sometimes people will have a scar that may have healed and looked great, and the psoriasis still develops maybe 6 months later. Even, it didn't happen immediately. So you could say, well, I got a tattoo and it looked really good, and you could still have psoriasis come up in the area. Now, this is not to say if you need a life-saving operation, you've broken your leg and you need to have, metal plate put in, or you have an appendix burst, get the surgery done. And if you get psoriasis in the scar, you can work on that with your dermatologist. But it's just another sort of risk factor if you're going to potentially damage your skin for basically so that your skin will look better in some manner, and then as a consequence, it is possible to get psoriasis develop in the area. So I would advise against it. But I did want to also say, if you decide to get the treatment or get the procedure, the psoriasis is not going to make a surgery fail. If you decide to get some cosmetic surgery or optional surgery, the psoriasis isn't going to mean like, the surgery is going to go bad. It's really a surface thing. The same thing with the tattoo. It doesn't mean that the tattoo is going to, mess up your skin in general. It just means you may have psoriasis on top of your tattoo.
Okay, so now we're moving on to the environmental triggers and the environmental group of questions. Burns is asking, they say that when you have psoriasis, you need to be under the sun because it helps. But I notice that I usually get red whenever I feel hot or when I am under the sun. Is it normal?
Oh, I love this question. Thank you so much for talking about this. Because we were talking about phototherapy early. Phototherapy is not a 100% cure-all or even 100% the right thing for everybody. There are plenty of people who actually are aggravated by the sun. And the only way to tell that is if, you notice I get hot and red and I get more psoriasis in the sun. So that's why phototherapy isn't perfect for everyone, or sun exposure, which we're going to talk about in a moment. So yes, burns, you probably are one of these people who has more photosensitive psoriasis, and all that typical advice about getting some sunshine, being in a warm climate may not work for you. And that's okay. That's okay. So this is normal. This doesn't mean anything wrong.
Right. Tanya is asking, so a slightly different question. So if the sun is beneficial, she's asking, how much sunshine should I be getting daily? And she's saying that she lives in the tropics.
Great. Here's what I'd probably say. Since I don't know I can't give you a specific answer because I don't know your skin's reaction to the sun normally, and I don't know where exactly in the tropics you are. But in general, if a person is going to use natural sunlight for their phototherapy, sometimes called heliotherapy, but if you're going to do that, really it's 10 minutes max that you need. It's really not very much. You do not need to go out and sunbathe and bake. It's 10 minutes of sun exposure. But here's the big but. The sun has to actually touch the areas of psoriasis. So if you do not have any psoriasis on your arms and face, and you go out and expose your arms and face, you're not going to get any benefit. So if you have, this is where it gets tricky. If you've got psoriasis under your arms, or you've got it, between your legs, you have to actually expose those areas to the sun. And because you live in the tropics, if you have psoriasis in those areas, those areas may be relatively photoprotected, so the rest of your skin is probably very accustomed to getting sunlight, and it won't burn. But if you go out and you decide you're going to, because you got psoriasis under one arm and you're going to expose your arm, that area is going to burn. So your first time you're out, 30 seconds of sun. really, really brief, and you'll do 30 seconds for a week. And then you'll increase by about 15 seconds a week. I mean, it's very, very gradual to work your way up. So if you went outside and you went like this for 10 minutes, you'd probably end up with a sunburn. So working on using natural sunlight for your phototherapy can work, but you have to be very, very disciplined with how you start to dose yourself, so to speak. You know, consider it like consider the sunlight like a medication that you have to get your body used to until it can tolerate the full amount.
That's fascinating. And to conclude the topic of sunlight, Oksana is asking, is living in the warm climate more beneficial and favorable to the skin?
Uh, well, I love this question, Oksana. I love the question, and in comparison with Vern's question. So maybe for you it is. For I'd say the majority of psoriasis patients, probably 80-ish%, 85%, yes, warmth and sunlight does help. But there's a sizable group of people where it doesn't. What's oftentimes funny is some people do better in dry heat, like going to the desert. There's a whole industry of psoriasis spas on the Dead Sea, for instance, where it's hot and dry, and you get the salt water, and that helps people. But some people prefer the moist heat. Some people prefer really to be somewhere like really dry and tropical. I have worked with a lot of people who have family in the Philippines, and so they'll have bad psoriasis when they're here in the United States. And I live in the Pacific Northwest, so it's kind of cold and not very sunny most of the time. But they'll go to the Philippines and like, oh, my skin is so much better. But a few people will go to the Philippines and say, it makes my psoriasis worse. So the answer is complicated. For many people, it is helpful, but not everybody benefits by being in a warm, sunny climate, and especially a warm, sunny, humid climate. Sometimes people don't respond well.
That's fascinating. How complicated the human body is, really. It's
Yeah.
so unpredictable. Right. So now we're moving on to the big category that interests everyone as much as the sun does. It's the diet. So I'm going to group four questions together. These questions were asked by Melis, Nancy, Revati, and Fida. They all are asking the question of which foods trigger psoriasis and which foods, on the contrary, can be beneficial.
I love that question. When people ask questions like what foods trigger psoriasis, what people are usually asking is they want to know the one thing they shouldn't eat. And when people ask what food cures psoriasis, they want to know that one thing they should eat, right? It looking for something super duper simple and concrete, like don't eat tomatoes, do eat bananas, right? And it's not that easy. I've talked already a lot about how complex psoriasis is. So when I think about what triggers psoriasis, what makes psoriasis worse, it's diets that are low in fiber and high in fat. And those are the two things in diet-wise, that and high alcohol consumption. So those three things actually are the things that have been shown to make psoriasis worse. Which in a way is good. It means that there's an enormous variety of foods that you can eat that are safe. It's finding that balance, making sure that you're eating enough fiber and that you're not eating a lot of high fat foods. And those, if you do that, you're doing a lot of good things for your psoriasis, a lot of good things to get you nutrients that will help your psoriasis and decrease the inflammation that high fat foods actually cause. So, in a way, I might say eat a big salad every day. Like if you want something that would be really good, high fiber, low fat, and that would do it. But what you put in the salad is up to you, so to speak.
Right. Can you give some examples of high fiber foods? What would be your favorite five high fiber foods?
So, well, obviously, raw vegetables have a lot of fiber. Fruits, many fruits have a lot of fiber in them. Surprisingly, raw nuts, if you don't have them cooked in oil or roasted in oil, either dry roasted or raw, things like one small one like an 30 grams of almonds contain something like six grams of fiber. And for psoriasis, you want to aim for at least 15 grams of fiber per day. So you can get, a third of your fiber just from a few almonds. Those are some good options. Other high fiber things are things like oatmeal. I like oatmeal. That's me. I think oatmeal is really useful and beneficial. There are other high fiber grains, like if you choose to get a bread that's got whole grains in them with high fiber content. So those are a few examples of some good things that are high fiber, but you don't have to go out of your way to eat something odd, right? You don't have to, just basically eat corn husks or something. That's not necessary.
Of course, with all the vegetables and fruit and different grains and nuts that exist in the world, I'm sure everyone can pick what they like and, get a good variety of different foods every day, which is also great for the microbiome. So there's something great and tasty for everyone. Fida actually was asking about supplements as well. Are there any particular supplements that we should be thinking about for psoriasis?
Uh, yes, but I'm going to say that I actually think the overall diet is more important. So if you were going to focus on something, I would focus on supplements last. Now, that said, there's been shown to be some help from zinc, from selenium. Well, let me go back. Zinc is really, really powerful for the skin. It really is. It's a good trace metal that we need that really has a lot to do with the skin. And I do believe that it's probably something to think about. Selenium is another one. A lot of people ask about vitamin D. Vitamin D appears to make a difference in only if you are vitamin D deficient to start with. So check your vitamin D levels before you start taking a lot of vitamin D. Now, as I said, I live up in the Seattle, and everybody's vitamin D deficient here. We don't see the sunshine for 9 months a year. There's just none, and we're all vitamin D deficient. So if you live in a place like that, then absolutely, you probably need some vitamin D. But definitely check before you start taking large quantities of vitamin D, and because it can run you into problems. And none of these nutrients need to be taken in extreme doses. They just don't. They just need to get a sort of baseline level of replacement. So taking far beyond the normal amount of any of these nutrients does not help you at all. And it can run you into some problems.
Right. Yes. I think a good kind of rule of thumb is to always consult your doctor and to get tested before you start taking any supplements, any tablets whatsoever, and to strive to get those nutrients in your body naturally with your diet.
Yes, definitely.
Let us just take a quick pause, just for me to remind you guys that Dr. Elizabeth Hughes has actually created a 14 video series talking about the biggest and most important topics and her biggest tips for psoriasis. So this playlist is available on our YouTube channel, but it's hidden, and you can get the link by downloading our app, and all new users of the app will get the link to watch that free series that Dr. Hughes has recorded. It's fantastic. It's jam-packed with information. But if you're thinking that you are already a user of our app, you're not a new user and you want to watch the series anyway, no worries. I will send you guys an email with the link so everyone can, all of the app users can watch the series. Okay, so moving on now, talking about pregnancy and post-pregnancy. So we have this question: how to deal with worsening of symptoms in pregnancy? I have psoriasis for almost 20 years, mostly in the scalp and in few more places, in one elbow and some spots on the face, arms, and legs. But now I'm dealing with an explosion in my belly and chest and a lot of itchiness. I'm struggling with this because hydration and emollient lotions aren't doing much. How to deal with it without using corticosteroids? Fun fact, in my first pregnancy, I had an improvement of symptoms with almost no psoriasis lesions. Thanks. Thank you for the question.
Yes, thank you for the question. Um, so let's talk about sort of psoriasis and pregnancy. And I did actually write an article in the app about psoriasis and pregnancy that you might want to check out, actually. So the question is, does psoriasis make your, or excuse me, does pregnancy make your psoriasis better or worse, or doesn't really affect it? And the truth of the matter is that those are pretty even. There are a number of people that will notice that their psoriasis actually gets much better during pregnancy. But there's another selection of people who will notice that it gets worse. And as anybody who's been pregnant more than once will tell you, every pregnancy is a little different. So it's interesting that this time you're having a flare and last time you did not have a flare. So yes, that's unfortunately how it goes sometimes. So I would suggest that you talk with your dermatologist about medications for the surface of the skin that might be safe during pregnancy. And if you think that you're not sensitive to the sun, you could consider phototherapy. As we talked about earlier, phototherapy is great for people who are pregnant, postpartum breastfeeding, who cannot take medication and don't want to use things on the surface of the skin. Phototherapy does not affect the baby at all in any way. So that might be a really good option for you. Itching is difficult. Oh my gosh, yes. And trying to find something that helps with itching can be really tough. You could talk with your dermatologist or with your obstetrician about whether or not a little bit of an antihistamine might help. I believe Benadryl is actually okay. I think you double check. But there are a few things that might be okay for the itching if it's really profound for you. And moisturizing, we're going to talk a little bit about skincare later, but what I want to say is you might need to sort of increase the potency of your moisturizer. Most moisturizers are mostly water. And this water does nothing for the skin. I mean, nothing. So you might want to switch to something that's much more greasy than you're used to. The way you can tell a moisturizer that has a lower water content is that it does not come out of a pump top. You can't pump it out of a pump top, or you can't squeeze, it's hard to squeeze out of a tube. So usually moisturizers that have low water content and high oil content, which is what you need, will be in a tub that you have to scoop out. Things that are more like the consistency of frosting or just actual grease than something that is more liquidy like like a sauce or like milk. So those are a few tips. I'm sorry you're going through this. It's really hard. I'm very sorry.
Right. The next question is pertinent to everyone, even though the context is pregnancy. So this user is asking, what is the number one thing that you recommend people with psoriasis to follow? I just gave birth 5 months ago and I have an ongoing flare-up since pregnancy that won't go away. I don't have time for anything except to moisturize my skin. What step is a priority and what helps the most?
Well, so again, it's that one thing, you're looking for that one thing that works for everyone. And so that might be hard to say. But one of the things that anybody who's just had a baby knows is that you frequently don't get enough sleep. And it is very clear that the lack of sleep actually affects psoriasis. So as much as you can work on sleep, that might be difficult for you right now. I know with a young baby. The other things that the other like really one thing that helps actually is stress management. And this, it's stressful to have an infant. I know I've got 2 kids, and it's stressful when you've got a newborn. But accepting help from people, if you've got family, friends around who can take the baby so that you can actually either take a nap or do something for yourself that is stress relieving. Like I know with my second child, I was like, take the baby, I got to go to yoga. Like that was what happened. So those are two stress and lack of sleep are two unrecognized significant triggers for psoriasis. And those would be things that I'd have people work on. But I get it, you're in a tough position right now, and it's really hard when you have an infant. But trying to optimize those as much as you can would be what I'd recommend for you.
Yes, accepting help is such a big unlocker because when you have that help, you can sleep, you can work out, go to that yoga, you can do a stress relieving activity. And we talk about this a lot at ACT. Social interactions themselves are a big, beneficial factor for psoriasis. Yeah.
Absolutely. People don't recognize that, but yes.
Mm-hmm. Yeah, so the next question is family related, but is on the genetics of psoriasis. And we actually have a whole segment dedicated to genetics in that 14 lesson series that we just talked about. So this is a fascinating topic. So this user is asking if psoriasis has a high chance to affect their children if they decide to have children.
Yeah, that's a great question. And I'm going to answer with some statistics. Obviously, statistics, aren't necessarily, they don't predict exactly what's going to happen for you, but I'm going to answer with some statistics. So about 30 to 40% of people with psoriasis have a family member who has psoriasis. But not every person who has a family member with psoriasis, that means 60 to 70% of people who have a parent with psoriasis does not have psoriasis themselves, right? The genetics of psoriasis are much more complicated. We think about things that are really simple genetics things where if you inherit one gene from one parent and you've got the condition. Well, psoriasis is lots of different genes inherited from two, and several of them need to be triggered. And we've got protective genes from maybe the parent that doesn't have psoriasis. So it gets to be really, really complicated. So if you have psoriasis and your partner who doesn't have psoriasis and you have children together, I'd say that the risk is less than half, significantly less than half, that a child would have psoriasis. And one other thing is people will often wonder, well, I have really severe psoriasis. And, and be very, very concerned that there's a higher risk of transmitting psoriasis to a child because of how severe it is. I'm one of these people that's, I've had times when I've been erythrodermic where my skin is covered 100% with psoriasis. That type of psoriasis, that severity of psoriasis doesn't predict worsening psoriasis in a child, or it doesn't predict a greater risk,
That's a relief. That's great. Awesome. So closing the topic of family and genetics, moving on to itching. So Marutha and Julian are both wondering what remedies for itching are there?
Oh, itching's bad. It's very bad. So I would start by rethinking and really looking at what you're doing for skincare. So remember how I said earlier when we were talking about skincare that water doesn't help psoriasis? It really doesn't, especially if you're using really hot showers, really hot baths. That actually does seem to be something that triggers psoriasis. So switching your shower or bathing routine to something that's a little cooler, definitely less inflaming, definitely less irritating to the skin. Making sure that you're using a moisturizer, one of those good moisturizers that I talked about earlier, the thicker ones, less water, more oil, and using that right after you shower. A lot of people will get out of the shower, towel off, go on with their day, and then moisturize at some other time later. It actually is more helpful to apply moisturizer when your skin is moist. Not that you're not locking in water. You can't lock in water. It's just a situation where your skin is more able to absorb the moisturizer at that point better. And making sure that even when your skin looks clear, that you're still moisturizing. A lot of people, if they get their skin clear, they just like, I'm done. And that's actually not really super helpful. Your skin's going to need moisture the whole way along. Using things like ice packs on specific itching areas right when you need it can be very soothing. Again, you want to avoid the heat, can help. There are a few prescription anti-itch creams that you could consider. And then there are some prescription anti-itch medications if you're really itching as well. And I would recommend talking with your doctor about those if you wanted to. But really changing the way you care for your skin and making sure that the skin barrier, the epidermal barrier, is really intact by avoiding, we'll talk about soap in a moment, but also avoiding harsh soaps as well can be really helpful. Making sure that especially as you get older, you don't need to use as much soap on your body on a regular basis. Obviously, if you're actually dirty, you're actually sweaty, and you need to rinse off, use some soap there. But a lot of times it is more beneficial to just wash the actually dirty areas with soap and just let water or even an oil-based cleanser use that for the rest of your skin.
Right. Let's actually talk about the soap. So your soap recommendations in general, and in particular, Marcella is asking whether you recommend the soap, the Dermabon soap.
Excellent. All right. So I have said this. I know I said this in the last Q&A I did. The last Ask Me Anything. I've got two categories of soap: bad soap and terrible soap. There is no soap that is actually truly therapeutic for your skin, which is funny because there are lots of things that are sold as true therapeutic things. The reason that I say that there's no good soap is what's in soap in general. If it's going to foam, right? If your soap is foamy, it means it has some surfactants in it. Surfactants are things that will bubble up and strip away oil when it gets to your skin. And so you can see when something bubbles and forms soap bubbles, it's got some surfactants in it. And that will make your skin drier in the long run, unless you moisturize. So you have to do skin care. The other thing about the soaps that contain active ingredients, medications, effective medications for your skin for psoriasis need to stay on your skin for hours. Soap stays on your skin for 30 seconds. So I'm familiar with the Dermabon soap, and it has some coal tar in it, and it has some good things like some glycerin and wheat germ oil, and they're all good things, but they're going to be on your skin for 30 seconds. So they're not actually going to make a huge difference for you. There's very different. You could take a mixture of what's in, I'm not suggesting you do this, by the way, please don't do what I'm saying, but you could take the things that are in the Dermabon soap and formulate them into a good moisturizing base of medication and put it on your skin. It would do a really good job for you. But this in a soap format, it's not great. It's not great. So I don't think it's necessary. It's in the bad, not horrible soap, but it's not truly good.
Great. And our other question concerning skincare came from Marcella as well. And Marcella is wondering whether exfoliation is really bad. And also asking, should scales be removed or not?
I love that question. So I said this earlier, there are two types of exfoliation. There's chemical exfoliation and there's physical exfoliation. Physical exfoliation is picking the scales off, scrubbing the scales off, rubbing them, or doing something to remove them with your hands or a sponge or something like that, a loofah. That's not a good idea. That is the sort of trauma, even though it doesn't feel really traumatic, but it's the sort of trauma that can trigger the Kebner phenomenon. So people will find, that they take the scales off only for the scales to generate even faster. You're like, overnight, they're back again. So that's not the thing to do. Chemical exfoliation is when you use some ingredient like salicylic acid, lactic acid, urea, to gently loosen the scales. So one of the reasons that your skin in psoriasis is scaly is the natural skin shedding process. We all shed skin all the time, but that natural process is disrupted and the skin just doesn't flake off in imperceptible layers. Because that's what happens to skin that's not affected by psoriasis, is we're always shedding skin constantly, but it just flakes off in such small quantities that we don't see it. We can't detect it. But when you've got psoriasis, that natural shedding is disrupted. So these chemical exfoliants will help that natural shedding to occur. It just helps the skin come off in those small imperceptible layers. Now, you might think, well, chemical exfoliants, maybe I should go and get a chemical peel or something on my psoriasis. Chemical peels, are designed to just basically destroy and remove the top layer of skin, which is, how it can, improve the look of your skin on your face if you've got lots of dead, dry skin. I wouldn't recommend that. You don't want to do anything that is so, how do I want to say, so dramatic all at once. You want whatever exfoliation with a chemical thing to be slow and imperceptible, basically.
Makes total sense. Switching gears completely and moving into the realm of psoriatic arthritis, and Burns is asking if there is a cure for psoriatic arthritis.
So at the moment, there is no cure for psoriatic arthritis. There are lots of treatments, as many treatments as there are for psoriasis, there are probably more for psoriatic arthritis. And I know you said that you've had a finger that's gotten swollen and it stayed swollen for a while. I would really recommend that you see either your dermatologist, and you might want to have a consultation with a rheumatologist, an arthritis specialist, to talk about what options are. And seeing a rheumatologist might do some testing to see if there are more joints affected than what you can see on your hand. So it might be worthwhile to do that.
Okay, so nearing the end now, we have two questions left. So this one is from Malika and it concerns stress reduction. So we know that stress is a big aggravator for psoriasis and for other things, other conditions that we all might have. And the question is, how much time should I meditate for? Or is there any alternative to control my anger issues and depression to decrease my psoriasis?
Yeah, well, I want to thank you so much for this question. And I also want to applaud you for noticing and being aware of the fact that anger issues and depression can definitely affect psoriasis. Absolutely. So, so meditation is useful. Absolutely. But it sounds like, well, I'll back up for a moment. I'm a big meditator. I meditate a lot. I teach people some meditation as part of what I do. But meditation alone, if you have some anger issues and depression, may not be enough. And it is helpful to find a therapist that you can talk about these things with. Because here's what I've discovered as people use meditation alone without sort of working on things through talking with people, is that you'll meditate for a little while and then you'll go out into the world with no, let's say, practical tools for how to recognize, oh, I think I'm having some anger now. What can I do in the moment? How can I rethink how I'm approaching this situation? Meditation, because the way people do it typically is they, set aside time and everything's good. And, like I'm meditating, I'm all calm. But if you don't know how to bring that calm with you, the meditation isn't enough. And seeing a therapist or working in another way to will help you bring that calm that you find in meditation into the rest of your life. So meditation's good, but it sounds like you need something else to complement it.
That's an excellent advice. So user is asking, is swimming in the sea useful for psoriasis? That's a good question.
That's a good question. Yeah, it's a good question. And there's a lot of different parts to this. So swimming is an excellent exercise for people with psoriasis. You don't get too hot, so you don't get sweaty. So people often are irritated by sweat. So that's fantastic. It's easy on the joints. So it's, that's wonderful for people who have some psoriatic arthritis or some joint swelling. So I think psoriasis is phenomenal for swimming, a phenomenal exercise. Swimming in the sea, there is a school of thought that swimming in salt water is helpful. And that's why I was talking about people who go to the Dead Sea, and swim in really salty water. Or here in the United States, you can go to the Great Salt Lake and swim in the salty water. Is that, is it absolutely necessary? I don't think that the salt water is. I think the benefit of swimming in the sea is probably mostly coming from the exercise and the enjoyment of swimming and getting some of that stress relieving that goes on. And the salt water is a little bit of it. So for those of you who are, don't have access to the sea, but you're interested in swimming, go swimming. It's fantastic. It's fantastic for your skin. But swimming in the sea.
Pool water? Sorry.
Yeah. Oh, that's great. Well, so first off, at least around where I am, there are more and more swimming pools that are using salt rather than chlorine. So you might be able to find a saltwater pool. And this is true for salt water, or if you're going into a regular chlorinated pool. Afterwards, you do need to rinse off. You don't want to leave whatever chemical it is, even if it's just natural salt from the ocean on your skin. That can actually be irritated, especially if you've got a chlorinated pool. You need to wash it off, and you need to moisturize afterwards. Same thing for both of those. So if you don't do what a lot of people do, is hop out of the pool, just throw something on, and then go on with your day. Stop, shower, get this chlorine or salt water off, moisturize fully, and then that's good, because you don't want to actually. Long exposure to water will dry out your skin. It just the natural oils. Maybe I should just explain that. When I say dry out your skin, I'm not talking about wet water. Skin doesn't need water. We need oil. And so being in the water for a long time will strip away that oil, and that lack of oiliness is what we see as dry skin. So you need to replace the oil on the surface.
Right. So staying with activities, Marcel is also asking, can I get massages like for relaxing?
Yes, absolutely. Now, if you have a tender joint or some place that's really sore or really inflamed, you might want to tell the masseuse beforehand that you've got an area of the body that you don't want to have massaged, which is fine. So if you've got swelling in your knee or something like that, you just skip that. The other thing I would recommend, if you are seeing a massage therapist and they have a choice of different oils to use as a massage oil, I'd recommend that you get a non-scented one. People sometimes will have reactions to some of the scented oils. It can be either a reaction on the surface of the skin, or sometimes oils will have a smell and cause some irritation of the nose. I've had that happen. I've been to a place where the oil that they used, I didn't like the smell, and I got kind of stuffy in the nose, and that could be another trigger for psoriasis. So massages are excellent. Ask the massage therapist to use an unscented oil and avoid any areas that are really sore at the time. Can a massage therapist massage over areas of psoriasis on the skin? Actually, it's fine. It will not harm it.
Okay, that's great. That's awesome. So the last question is from Carrie, and it concerns inflammation. They're asking, what's the key to lowering your inflammation? Such a loaded question.
It's a great question, and that's why I'm so glad you asked it. So thank you, Carrie, for asking that. There are a lot of things. There are basically, we at ACT have looked at sort of 8 different factors in lifestyle that go into lowering inflammation. So we talk about things like alcohol. We talk about things like sleep, stress management, diet, exercise, social relationships. All of these things go into changing how your psoriasis, your level of inflammation. And every single one of them has actually been shown, scientifically to change what are called the inflammatory markers, the blood tests, the biomarkers within us, so that people who, we were talking earlier about social connection, people who are more lonely or more socially disconnected actually have more inflammation. It's part of it. So there's lowering inflammation is really a lot about leading a lifestyle that is, I want to say healthy, but that's not necessary, but it's all of your life. It's not just what you eat. It's who you're with. It's how you're relaxing. It's how you're sleeping. All of those things go into lowering inflammation. What would you want to add there?
Right. But so it might seem really overwhelming. We actually might have a solution to facilitate, the transitioning into this healthier lifestyle. So this new product that we talked about at the beginning that we devoted a lot of time to develop is actually lifestyle plans. So Elizabeth is not only a board certified dermatologist, she's also a health coach, a very well-rounded practitioner with a lot of expertise in dealing with psoriasis from all the different angles. And we are so happy to have created these lifestyle plans.
So we have created a really unique sort of inventory of questions for you to answer about all different factors of your lifestyle. And using that, we can pinpoint the area or a couple areas that would be most beneficial to you. I mean, we've taken all of this stuff that looks like, how am I going to track all of this? Well, we can track it and turn it into numbers so you can see how you're doing. And so once we see what are those areas which are, let's say, most out of balance for you, then you can get a plan for how to bring it back into balance over about 10, 12 weeks. You'll have a totally comprehensible, totally doable, don't have to, change your life or stand on your head sort of way to get your life shifted, get those, those areas that are most, will have the biggest impact for you, shift those back into balance. And the great thing about this is once you've done this and you've instituted it, the benefits are forever, right? Unlike medicines that sort of come and go and they're better and they're worse and they're better and they're worse, and then, once you do this, and it's locked in, it's good. You don't have to worry about that as a thing that will, you have to mess with in the future.
Exactly. Once you have generated those healthy habits, it's just easy and effortless to keep practicing those healthy habits on a day-to-day basis. And we keep, emphasizing that a good lifestyle is not only beneficial for psoriasis per se, but a good solid lifestyle actually helps your medication perform better. So it's so powerful.
Yeah. That is a point to make. For people who are either on medication, you might say, I don't need to do this. Um, Actually, there's really good studies that show that people who enact these lifestyle changes get a boost in efficacy of their medication between, the medication clears more of their psoriasis, and the medication's duration of effect is longer by a significant amount. So even if you're using a medication and you believe that it's all right, the there's still benefit for you. Definitely benefit to working on your lifestyle plan.
So yes, if you need that extra boost, if you need that extra guidance, then we can create a plan for you based on that diagnostic questionnaire that Elizabeth talked about. So you can go to act.bio/plan and check out the plans. And we have a discount running until the end of September because we're still finalizing development. So you can get that early bird discount until the end of September. So the URL is act.bio/plan, and we can, check out all the details and send us a question if you have one on the plans. And I think that those plans will be a huge help for many people.
Yeah.
So we've covered all the questions, except for the ones that were really personalized, really personal, and really focused on specific treatment plans. So thank you again so much for all of you guys that have sent the questions. And thank you for watching as well.
Yes, thank
you,
you so
Elizabeth,
much.
for answering.
Happy to do it. Really, send me more.
And happy Psoriasis Awareness Month.
Right.